Shy sitting alone. Yes. Let people join, right? Ganesh, all are here? Those who have to present today?
No, Father. Actually, two more has to join. They're coming, Father.
Christina is starting your duty tomorrow.
Yes, Father.
Best wishes.
Thank you, Father.
Okay. Keep cool. Don't take stress. Learn little by bit.
Okay, Father.
Between duty, sometimes spend at least 15 minutes when if you are busy.
Okay, Father.
And don't get disconnected. Yes. Many was lying that she doesn't have good pics, but she has put good pics in the DP now.
Where is in WhatsApp?
Yeah.
That is actually done for the nurses' day. That is a college pic.
Yes. What else? Samjana. Admit people. Co-host. Yes. How is the task going?
Very good, sir.
People are doing, I believe, right?
Yes. Almost 10 people completed.
You can advise them if they are doing full-time study and all, they can do more. If need be, we can post all the some 20 or 25 materials what we have, no?
Okay.
Materials and videos. Maybe I'll try to put the material and videos linked together if possible.
Good evening, Father.
Pardon. Good evening. Good evening. I don't know. Someone had sent me all the A part connected, no? Only A parts. If I could know who has sent me, I could search it and send it back. Only A parts, no? PDF was connected. 10 or 15 materials earlier batch. Any admins remember? It was like in one PDF, no? When we could post it in advance, like so that they can practice if at all needed, at least in the advanced batch, special batch, and all that.
So, maybe we can give our discussion group because today also added 4 people to discussion group. Since they are very active, shall we give to them the week?
Is Vantika added to special this one batch? Vantika? I actually added her twice. I think some other name probably.
Good evening, Father.
But Father,
So Vantika, can you speak?
Good evening, Father.
Good evening. Hey, are you added to special batch?
No, no, Father. Still, it's coming like that. It's expired. It's showing expired.
Showing? But actually, I added you. Other day, I added again. I added 2 Vantikas are added. I asked Anita Taj to remove the unreal Vantika. Not active Vantika. Special batch. Somebody please check if she can. Yeah. Somebody please check if she is seen in the special batch. Those are in the special batch. Vantika.
Good evening, Father.
Good evening. Discuss something until people join. Yeah, people are already there. I'm adding you now. Check, okay? It says you are added.
Okay, Father.
When earlier I added, I don't know which one to come. Not added, right? Are you able to join with the link?
Father, just now, but it's still showing expired. But now again, I am doing this.
Maybe some technical issue with your application, I believe. You can't join with the link as well, right?
Yes, Father.
I have sent the link. Click on the link and try in the Telegram, in your personal Telegram. Okay, I think you can go. Vantika, I have sent your link, special batch link, in your Telegram. So best wishes. Try joining, clicking that link. Everyone, just type in, where are you from? So best wishes, rocking discussions on starting on real reading part A. Okay. Mini, tomorrow onwards you will open, right? Tomorrow I can open, day after tomorrow onwards.
Okay, teacher.
I'll be following. Vantika, did you succeed?
Yes, I am trying, Father, but it's still showing like that. I don't know why.
You can just uninstall your Telegram and install again, ma. Probably not now. Later you
Okay,
uninstall.
okay. Now
Uninstall. Pardon?
okay.
Because I added you 2-3 times.
Let
No.
install time.
Pardon? Nothing happens. All the details will be there. Even if you uninstall and reinstall, details will be there. All the chat will be there. You won't lose it. Okay, thank you, Ganesh,
Okay.
for the super chat. One more super chat was that. Yeah, Susan Varghese, thank you for the super chat. Yes. My OET will explain before. Explain if there any possible to get license. Yes. Anu Sabine is sending some bombs in the chat, so we'll have to start. Yes. Yes. Okay. Best wishes. Carry on. You have any suggestions for the session after this? Because I think I have taken more than 20 authentic materials here part. Again, that's more than enough to practice for anyone with all methods and different methods, like starting from 12 steps, 8 steps, 4 steps. For beginners, 12 steps. Then as you go on 8 steps, then you are advanced 4 steps. Right? What do you think? What should I take? If we have some clarifications, we can have a Q&A session. Or do you want me to take any material, explain any material?
Father, last week you have said a new method for part C reading. No, the question, how like categorizing questions, one side categorizing answers, options,
Okay.
like in such a way. Is there any method for this party reading as well? Because we used to skim and scam the text, and we have to write all the full text, whatever the headline text, whatever the text having.
Actually, in the 12 steps method, I have given such a method where you identify, create 4 columns and write, sort out all the hedging words into the columns. That is exactly the same method. In the 12 steps method. In the latest 4 steps method for advanced people, you may not find it. Where you have to, like, that helps a lot. Like, you create 4 headings, right? Then you put them
Yes,
4
sir.
headings into 4 columns. Then below you enter all the hedging words from the questions. Then you write in the brackets the corresponding hedging word or synonym from the text. Either you can make 2 columns under the same heading. One is question column, one is text column, under all the 4 headings. Actually, I have explained it in almost all first 8 reading part A sessions. I have explained that. Starting from the first one, diabetes, no? First one.
Yes, sir.
Maybe next tomorrow's is that, I believe. 20th, 39th or 40th. 40th must be that. Okay. Yeah. And A part is very easy. Today I got a couple of messages saying that we have finished in 8 minutes, 9 minutes, 14 minutes. All score was 19, 20, 19. Even in main platform, I have posted some. Once you get it, you will easily get it. Within 10 minutes, done, 20 marks. Then you have 5 minutes. If at all you have made some mistake somewhere, you can deal with it.
Sometimes big paragraph coming, Father. We cannot read out. So that much big paragraph coming.
No, big paragraphs you won't get. Very small paragraphs you will get for the exam. Real exam. Very small paragraphs. Not as big as even the sample. Even if it is big, you are not going to read everything, right? You are just going to skim and use the strategies. So reading everything, even I may not be able to complete within the time. If I were to read all the B part, C part, all the text and everything and understand everything, no one will be able to complete it. They don't expect us to read everything even in the paragraph. If it's, so many questions you can manage just by reading the topic sentence or just glancing at the name or just glancing at the contrast word and reading after it. And many other you can eliminate, right? So reading everything you can do. Once you come back after the exams, next day you can start reading everything. The examination, no, don't do it. They don't expect you to. But for badly enough, almost all majority of the students do that. And I wonder they should be given Oscar award if we can read and understand everything and answer the questions within that given time. Yes.
Thank you.
Yes. Then you can go on. Let me see. Thank you. Yeah, Mr. Severus, thank you so much for the super chat. Yes. Great. You can get for 10 rupees, you can get a super chat by clicking the dollar button there. Yeah, that helps our reach and also your love for the mission. Yes. That tech team is particular that I should announce it every day. Okay. Good. Okay, carry on. I'll join. Yes. Over to Ganesh with a smile.
Thank you for it. So good evening, everyone. I would like to hand over to Minimum. I think. Minimum.
Yes, Ganesh.
Please mute those who have distractions at the background. There's a lot of distractions.
So you are here. I cannot handle the session. Please handle the session, ma'am.
Ganesh. Okay, good evening all. Today's discussion will start now, and before going to start our discussion, we'll take a 1 minute for the silent prayer. Once again, and thank you all, and happy to be here again after a break. I am here back, and I want to say the thanks to the Father Salim Joseph for giving me an opportunity to be here, part of EduSkill platform, and as well as the admins and all the aspirants who are gathered here. And good evening all once again, and we will start our discussion. And for the today's coordination, I will welcome the Bharati to coordinate today's discussion. Bharati, you are welcome to coordinate.
Thank you, ma'am. Good evening. I am Bharati from EduSkills family. And first of all, I would like to thank our Father Salim Joseph and our admin panel members and each one of the aspirants who are gathered here. Thank God giving this opportunity. This is a very blessed platform. So please follow and be here and for the discussion classes. It is very useful. I am very thankful for our father and our admin panel. They are doing grateful job and help for us. It is really blessed platform and God will give rewards to them. Okay, today we will start our reading part A discussion. Part A, I will explain what is there. It is one health topic will be there. Four tests, it is in the related test, and it will be total. We will get 20 questions. We will get 20 marks, and it will take 15 minutes. We have to finish according to our father strategies and his tips. We can make it within 10 or 9 minutes. So I hope we will all do that. First, we will get matching questions 5, then other sentence completion and other short answer questions. Total, we will get 20 questions. Then reading part A, experience reading. It means we have to read fast. We will not take time or waste time to read all those things according to the father, what he told us, and do this skim and scanning method. Skim method means you have to focus on each test, skim, search for clues like title, section heading, subheadings, names, number, sequential expression, like first of all, secondary, another like frequency expression, then scale expression, most many few adjectives, it like beautiful, like adjective words you can find, and negative expression. You can find clues like that. Then you can go mm, the questions. It is easy for you to get the answer. For the tortoise, 7 steps method, like main heading. You have to visualize the heading first. If it is, now today we are taking a necrotizing facilities, means you can visualize the subject and you can write down the 4 tests, test A, B, C, D. Heading, you can see the heading. Otherwise, if you are not seeing the heading, you can use a topic sentence as a heading. Then you can 4 tests, you have to skim A, B, C, D each 20 seconds. You have to finish it within 20 seconds. Then read questions Question 8 to 20, you can write which belongs to this question is coming A test or B or C or D. Then locate the answer in the test and write down answer in the same given space. And finally, you can proofreading. That is very important. You have to check your spelling. Okay. I hope I explained regarding part A. Then today I will welcome our discussion members. Mrs. Anu Sebin, please come forward and provide your presentation regarding necrotizing Facitiis, question number 125. Please, Anu.
Thank you, Bharati. Good evening, everyone. My name is Anu. I'm one of the OET aspirants from EduSkills International. So, thank you for giving this opportunity. First of all,
Elizabeth.
I'm thanking.
Elizabeth, PPT.
Yeah, first of all, I'm thanking Father Salim Joseph and Admin Fanas for giving this opportunity. So, today we are dealing about OET Part A reading. The topic is necrotizing Facitiis. Here I'm discussing question number 1 to 5.
Elizabeth, PPT.
Elizabeth, it's muted.
Oh, ma'am, I think the network issue is not loading. Can see.
Ganesh, can you share it?
Ma'am, okay, but I might be disconnected. No, ma'am, actually, I'm also having network issue. Okay, I'll try, ma'am. I'll share.
Otherwise, send it to me. I will share it.
Okay, ma'am. I'm sending.
Briefly, we can explain about the part introduction, okay? Until we reach the PPT.
Ma'am, I have sent you.
Ganesh, I didn't get, okay? Acha, can you give me the permission for the sharing? Is it visible? Right?
Yes, ma'am.
Yes, ma'am. Visible.
Do you want this slide or directly we'll go for the question?
Directly, yeah, because she explained everything.
Ganesh?
Ma'am,
Ganesh, this is not the
ma'am,
slide.
ma'am,
This is the slide.
ma'am, I'm not getting you.
This is not the today's topic.
Wait a minute.
Necrotizing suicide.
Education resources, discussion resource group I have posted, madam.
Just give me 1 minute.
Ganesh, the link sent by Dorothy is the one loading, right? I cannot open.
Okay, good.
Got it, ma'am?
Yes. Okay. Sorry. Is it us? Ganesh?
Yes, ma'am.
Okay.
Yes.
Good others.
Yes, today we are discussing about reading part A, necrotizing Facitiis. And first of all, skim the 4 tests and write down a heading for each test. So that thing first we have to do. So we all go into the test, and in the test A, we can see that definition and classification there is no main heading there, even though when we read the topic sentence, we can understand that there is a definition and classification test A. And test B is mentioned in treatment. And test C, supportive care, and test D, advice on aftercare. These all the heading we can see. So second method, skim the 4 tests and highlight the clues. So what we look for when skimming the test. So first we have to highlight for title, section heading, subheading, names or number, percent, sequential expression, frequency expression, scale, adjective, conjunction, and negative expression. We have to skim for these all things. Skimming means just we are glance to the test and finding these all things. Okay. The question. First question is the drug treatment required. So we know that where is the treatment is. We already noticed that treatment in part B. So we can see that part B is the answer. Second one, which part of the body can be affected? Part of the body can be affected is mentioned in the part A. There is mentioned soft tissue infection that develop in the scrotum and perineum. This all that mentioned in the test A. So the answer is A. 3, the various ways calorie can be introduced. It's mentioned in the part C. Calorie intake to combat infection is mentioned in the part C. And question number 4, who to contact the help the patient after they leave hospital. So aftercare is mentioned in the part D part. So we can see the answer is D. What kind of stressing to use? So supportive care. So there is mentioned about the dressing like vacuum assisted closures how to use this. All the things is mentioned in the part C. So the answer is part C. So thank you for your cooperation. If you have any question, you can ask me at last. Thank you.
Thank you, Anusabin. You done good. You are nicely. You explained the test, and you are making the test heading A, B, C, D. Like A is definition and classification. So main heading is necrotizing facilities. Test A is regarding definition and the classification, and B is regarding antibiotic and treatment. Test C is regarding supportive care, and the test D is advice to give the patient before discharge. Nicely you explain the questions 1 to 5. I would like to call our second participant, Mrs. Varsha. Please come forward. Kindly explain your questions 6 to 10, please.
Yeah, thank you, Bharti. Good evening, all. Good evening, Father, and all my colleagues. I am Varsha, one of the OET aspirant from the Edu Skills family. Today, I am going to present the question number 6 to 10. As now, Anu explained, given the brief introduction of part A, and we will follow the 4 steps as per the father strategy. In that first step, we are following the scheme, the 4 text, and write down the heading of each text. First text is we have given the description and classification. B has the given treatment. C is the supportive care, and D is the advice on aftercare. So we will write the in at the corner of the paper. Next slide, please. Next here. Now I have shown the how we can mention in the corner of the paper. The same way we have to practice the same every time. So we will get the answer. We will be easy to find out the answer easily. Here, next slide, please. Next slide. Now we have marked the hedging words. In question 6, how long to give drug therapy to the patient? Here is a hedging word is a drug therapy. In question 7, what advice to give the patient regarding the needle use? And the hedging word is advice and needle. And in question 8, which 2 drugs can you use to treat the Clostridium species of pathogen? Here we can mark as 2 drugs and the Clostridium species of the pathogen. In question 9, the hedging word is which common metabolic condition may occur in NF? That is a metabolic condition we have to find out. And in 10, what complication can patients suffer for NF isn't treated quickly enough? So the hedging word is a complication. Now in the next slide, please. Now we will, as per hedging words, we can find out which text is matching with the questions. So in the first, say, 6 questions, as per the drug therapy, we can see that there is a B is a treatment in which drug has a described. So we can mark the B for the question number 6. And in the 7, what advice to give a patient regarding the needle use? So it is given in the text D, and so we will mark the D. And in questions 8, which 2 drugs can we give for the Clostridium species pathogen? That is also part of the drugs, so it comes under the text B. So we will mark the B text. And in 9th question, the common metabolic condition, that metabolic condition descriptions comes under the A, that's the description and classification. So we can mark A for the question 9. In question 10, what complication can patient suffer from NF isn't treated quickly enough?
that is also comes under the part A. So we will mark the A. And now we will find out the answer as per the. So question 6, it is given in the text B, and it has shown that the main duration of antibiotic therapy for NF is the 4 to 6. So we can find out our answer, and we are correct as a answer B. Then question number 7, next slide, please. Yes. Here in the text D, it has what precautions about the needle, what advice about the needles for the patient, which is explained here. So we will mark question D, and the answer is the given, the keep needles capped until use and not to use the needles. Previous slide, please. No. Yes, thank you. Here the which drugs for the Clostridium species. So here it is given under type 3. NF should be managed with clindamycin and penicillin, which kills the Clostridium species. So we can locate the answer in text B under types 3. Now next slide, please. Question number 9. Yes, it is which metabolic condition which mentioned here. So we can mention the comorbidities. It's a paraphrase used for the metabolic conditions. So we can mark diabetes mellitus. So the answer located here. And for the question number 10, the infection progress, it is paraphrasing language used here. If not treated in time, means that is the infection progresses rapidly and septic shock may ensure. Means it a paraphrasing language used, and we can mark the answer for the 10. Here the infection just a minute. Can you show the previous slide, please? Previous questions. Yes. What complication can a patient suffer from NF? It isn't treated quickly enough. So that answer they have shown here. The complication exactly they mentioned means can patient go in the septic shock? That is our answer. I hope I cleared the topic. If you have any queries or questions, you can ask at the end of the session. Thank you all.
Thank you for PPT and firstly, nicely mentioned about each questions, the hedging words, and like the hedging words with the test, and you found the answer. It was very nice. Thank you. I will call our next participant, Sanjana. Please come forward and please explain 11 and 15 questions, please.
Hello, thank you, Bharati. Good evening, all. I'm Samjana, one of the OET aspirants from EduSkills International. First of all, I would like to thank Dr. Father Solin Joseph, the admin panel team, and all the participants in this group for giving me this opportunity to speak about the reading part A, question number 11 to 15. Yeah, next slide, please. Today's our part A topic is necrotizing Facitiis. So now I'm going to explain question 11. Yeah, 11 to 15. Sorry. First slide, please. sorry, I have a problem with PPT, so I use all father's slides. So thank you, Father, for allowing me to use your slides. Now I'm going to explain 11 to 15. Question number 11. What procedure can you use with a wound if the patient can't be operated on? So in these questions, this question asking for procedure. So we can, according to Father strategy, we will do 4 headings. So in first, A, description and classification, B, treatment, and C, supportive care, and D, advice on aftercare. So in these questions, we can find procedure. So we can find in the text C, supportive care. So we can write the C. First of all, we need to find out the topic. Then question number 12, what should we, sorry for disturbing. Then question number 12, what should we patient to be told to use the clean and injection site? So this questions asking for what we can use to the clean the injection site. So we can use heading for advice on aftercare. Pause. I'm very sorry due to my baby. Sorry for that. Now we can, in question number 12, we can use text D. Then now I'm going to question number 13. Which 2 drugs can be used if you can't use vancomycin? So this question asking for 2 drugs. If we can't use vancomycin, then we can use which 2 drugs we can use. So drugs mean treatment. So we can use text B. Then in question number 14, what kinds of infection should you use tetracycline for? So here also we can highlight the hedging words, tetracyclines. So what kinds of infection we can use tetracycline? So this one also, this question asking for which kind of infection. So we can highlight the tetracycline. This one also treatment. So we can highlight the text. We can find out in the treatment. Then question 15, what average proportion of patients who die is a result of contracting necrotizing fasciitis is? So here we need to find out the proportion. And here we can highlight the average proportion, and we can find in the text A. Sorry, next slide, please. And according to further strategy, in question number 11, they are asking for it. This question asking for procedure name. So treatment. Sorry for that. I'm very sorry. Sorry, next slide, please. Text C, please. Three, four, ma'am. Yeah, here, question number 11, asking for procedure. What procedure can you use within a wound if the patient can't be operated on? So according to further strategy, if in the text, if we found in the any abbreviation, so that will be in the right answer. So here in the text C, heading supportive care. So we needed here this question asking for procedure name. So we can go directly to the wound care. Then we can see here VAC is abbreviation of vacuum assisted closure. This one, vacuum assisted closure, was recently reported to be effective in a patient whose cardiac status was too precocious to undergo a long surgical reconstruction operation. So we can see here procedure name. This is a vacuum assisted closure is a procedure name. So we can write the vacuum assisted closure. This is a procedure. We can found this question number 11. Answer is vacuum assisted closure. Then now question number 12. Next slide, please. What should the patient be told to use to clean injection site? This one, sorry, D text, ma'am. Yeah, thank you, ma'am. In text D, here advice to give the patient before discharge. So in this text, question asking for what we can use to clean the injection site. So here in the last paragraph, last sentence, we can find the answer. Clean the skin thoroughly before blood glucose testing or insulin injection, and to use alcohol pads to clean the area afterwards. So here also asking for what injection site. Yeah, so before doing blood glucose testing or insulin injection, we can use alcohol pads. 12 number answer is alcohol pads. Now I'm going to talk question number 13. Which drugs can be used if you can't use vancomycin? So text B is treatment. Yeah, here in the text B, heading is treatment. So we can go through text B directly. And here type 2. In the type 2, there is a MRSA tends to be covered by vancomycin or daptomycin and linezolid in case where S. aureus is resistant to vancomycin. So here, according to further strategy, we can give answer daptomycin and linezolid, because here and according to further strategy, if there is a conjunction word, that will be the right answer. So here daptomycin and linezolid, this one is the answer of question number 13, two drugs name. Then resistant means synonym of can't use. If if resistant, so we can use these drugs. Then now I'm going to question number 14. What kinds of infections should you use tetracycline for? This one also asking for treatment. So we can go to text B again. Then here also type 3. Sorry. We can see here sorry, what here also we can highlight the hedging words tetracycline. So we can see here if Vibrio infection is suspected, I'm very sorry, just for a minute, this I'm very sorry. Here we can use here is the answer what kind of infection. So if Vibrio infection is suspected, we can use tetracycline. So answer is Vibrio infection. And question number 15, the average proportion of patients who die as a result of contracting necrotizing fasciitis is this one is text A. So we can go through text A. In the fourth paragraph, we can see may ensure. Here also may is a modal verb. We can see if according to further strategy, if we see any modal verb, that also one clue for answers. So after that we can see the mortality rate is high, median mortality is 32.2%. That is question asking for average proportion. So proportion means percent. So we can use 32.2%. According to further strategy, if any in the text any percentage or number, we can see that will be also right answer. So we can see here 32.2% average proportion, and mortality is synonym of die. So 32.2% is answer of average proportion. Thank you. Sorry for that. Today I have more distraction. Sorry for that.
Thank you, Sanjana. You nicely explained. Thank you for your colorful PPT, and you nicely mentioned glitching words, and you are using the 13% for the conjunction also. And if it is various conjunction word, we can easily find out the name. Then you mention about the abbreviations and number also. Very nicely you used for the strategies. Thank you, Sanjana. Finally, I'm calling Miss Joyce. Now, Joyce, please come forward and do your questions.
Good evening, everyone. Myself, Josina, one of the OET aspirants from Edu Skills International. And thank you so much, Father and admin panel, for this wonderful opportunity. Today, I'm going to deal with question number 16 to 20. Question number 16. Patients who have eaten dash may be infected with Aeromonas hydrophilia. The hedging words are eaten, infected with Aeromonas hydrophilia. So, in text A, can you change the slide? So, in text A, they are saying about description and classification. In that 4 column, in the last column, we can see that seafood. So the answer is seafood. The question is asking about food. So the answer is seafood. Then question number 17. Patient with type 2 infection usually present with infected dash. The hedging words are type 2 infection. Can you change the slide? So the hedging words are type 2 infection. So here the question is asking about body part. So in question A, we can see that in the third column, under site of infection, they are mentioning limbs. So the answer is limb. The question is asking about type 2 infection. So in text A, we can see that type 2. In that type 2 under site of infection, we can see that limbs. So the answer is limbs. Then question number 18, type 1 NF is also known as dash. So the hedging words are type 1. In text A, we can see that first column type 1 polymicrobial. So the answer is polymicrobial. Question number 90. Can you change the slide? Question number 90. The patient needs to be aware of the need to keep glycated hemoglobin levels lower than. So the hedging words is glycated hemoglobin levels lower than. So in text D is saying about advice to give the patient before discharge. In that paragraph, the last paragraph is saying about remind the diabetic patient to. In that sentence, we can see that control blood glucose level, keeping the glycated hemoglobin HbA1c level to 7% or less. So the answer is 7%. Because in question, they are asking about lower than. Lower than is the synonym of less. So no need to repeat again less. So the answer is 7%. If there is a digit, then we have to pronounce it as 7%, not 7%. If there is no digit, for example, high percentage, low percentage, then we can pronounce it as high percentage or low percentage. If there is digit, then we have to say it as 7%. Question number 20. The patient will need a course of dash to regain fitness level after returning home. The hedging words is after returning home. So in text D, we can see that advice to give the patient before discharge. In that paragraph, can you change the slide? In that paragraph, the third line, physical therapy section to help rebuild strength and promote the return to optimal physical health. So the question is asking about patient will need a course of dash to regain fitness level after returning to home. So the answer is physical therapy. Okay, thank you.
Thank you, Sanjana, thank you, Joy, for your wonderful PPT, and you explained very well synonyms language, and you explained nicely regarding the 19th question. The patient needs to be aware of the need to keep electrolyte hemoglobin levels lower than we will write 7% less. In the copy paste, we will do it urgently or emergency we are writing. But you mentioned it is already test is mentioned, question is mentioned, it is lower than, so you nicely mentioned 7% only need to write it. Then you explained regarding percentage and percent. So digit means we need to read percent. If it is lower percentage, high percentage means we need to percentage, we need to read it. And very well you explained, Jyotsna. Thank you. I am giving to Minima. Thank you, Minima.
Thank you all the aspirants who have done your part well. In the discussion, you have made the PPTs and you have explained well about your part each questions and how you're going to identify the questions. And each question there is a keywords and how we need to correlate with the question and on the text, and everything was explained well in manner. Now the time to hand over to the father. Father. Until father will reach, I will give you a brief review about the part A, how we can able to do it within the 10 minutes. Okay, this is according to our father's strategy. We need to follow that. Okay, actually, when you will going to see the passages, first you have to look the passage heading. That is the main heading. That is enough will be there. Other passage, paracetamol, any kind of the passage will be there. But you have to find out what the topic is that. Then look for the heading. This is a small quick skimming for to identify the heading. Then what you have to do, if there is no heading or subheading, you can read the first line. Okay, and just write the heading, heading. Identify the heading and write it in the each corner of your papers. Then next come back to do the skimming. Okay, skimming for the clues. How you will going to do the skimming? You need to find out the heading, subheading, titles, numbers, percentage, adjectives, negative expression, each and everything you will going to mark it. During the time of initial stage, you have to find it read each line and find everything where it is given. Okay, and in the advanced stage, just look and briefly just go to that, then write or underline the important words, whatever name or abbreviations is given, something like that. You are just underline and go. Then again, come back to the question and just a quick read and underline the keyword. Then you can understand, okay, where it is in the text. Okay, you can write a ABCD in the 1 to 20 question. Then again, go back. Okay, and again, what we're going to do, that is a correlation with the question and the text where it is given. Then we'll come back again with the question and read thoroughly each question. Okay, each question we're going to read thoroughly, and you know the answer it is will be within the A or B or C. Okay, directly you will going to search the answer in that only text. No need to look the other other text, like if it is answer within the B, don't want to look for the A or C or D passages or text. Okay, so directly you can correlate your answer. If you cannot find the answer within the seconds, just skip and go. Okay, you can mark it in the with a pencil. You can mark it, just cross it in the left side or left side, just mark it with a small point. Okay, you didn't find the answer, then come to the another question and do it. After that everything is completed, then come back to the question where it was skipped. Okay, then you can get the time. Then it's a one important thing, it's a proofreading. According to further strategy, we will going to finish it everything within the 10 minutes. If you're going to practice in the advanced stage, you can write the ABCD for the 20 and look forward. Otherwise, you can ask how you will go. How you will going to practice, that is according to your wish. Okay, you will going to practice with ABCD, or maybe you will going to correlate with the question stem and keywords. Then we will go and do find the answers from the text. Okay, but according to my experience, when they take a 1 minute extra to write a 1 to 3 questions, 22 ABCD, put ABCD in the not in the answer side, in the above the question you can write ABCD in the small letters. Then correlate the question and go back and correlate with the text and write it. That will be easy, because for the each text we're going to take 15 to 20 seconds to skim and scan. Okay, then again 1 minute, if you have okay, that is a capability to go fast, take a 1 minute or a half 30 seconds to 1 minute to find each the text where it is in the question stem. Okay, correlate, then you can go on with. Then after completion, anyway, whatever it is, you will going to complete it within the 12 minutes. More than 30 minutes will not going to have. Okay, then after that you have left 2 minutes, at least 2 minutes will be there. Go and search all the questions again and find any mistake you have done or any corrections you need to make, or maybe you wrote the wrong answer or spelling mistake or plural you have to write, but you wrote in the singular, but you have to correct it, then correct it that, okay? That utilize the proofreading for the 2 minutes at least. So I hope it's clear. And but for the beginners, you need to starting stage, you have to read and understand each line and the strategy of the Father Salim to understand or crack the 10 minutes mission, okay? I hope it's clear. If you have any more doubt regarding the part A, you can raise your question. I'm ready to help you.
Thank you, ma'am, for sharing, because I was confused with how to read the proofreading. So it get more clarity about the proofreading.
Watson came back. Shanmugam.
I have a question regarding this 9th one.
9th question.
Sorry, 10th one. There are what complication can be a patient suffer from if NF isn't treated quickly enough. So when it comes to complication, why it is A? Because A is regarding the classification and definition, right?
So which
So why the
common condition is may occur? Where it is a, it will comes under the A, yes.
May.
Condition totally.
Condition, that is classification of the responsible pathogen according to the type of infection. There is a different type of is there microbial, is there type 1, type 2, type 3 and type 4 is there. Then under the type 1 there is a comorbidities. Comorbidities means that is I think combination of the conditions. Okay, comorbidities combination of the condition. Maybe the 2 or more than conditions will come together. Here it's a diabetic mellitus. That is the metabolic conditions always, we know that the metabolic conditions will affect on the, where it is.
No, ma'am, I'm asking about the 10th one. They're asking about the complication. Can a patient suffer from NF? So when it comes to complication, the complication is spoken in text C, like the supportive care.
Can be a patient suffer from.
This is complication in text, right?
Quickly, yes, it's not.
Ma'am, excuse me, may I explain?
Who took the question?
Yeah, and Varsha.
Go for Varsha.
The last question, the 10 questions I explained.
Varsha, you can give the answer back.
Yeah. Yeah. Because, ma'am, it is given what complication can a patient suffer from NF isn't treated quickly enough. So it is in the first paragraph of text A, it is clearly mentioned that the infection progresses. Progresses means it's going and increasing, not reducing rapidly, and septic shock may ensure. Means what complication may occur the septic shock if not treated in time. If the progression is keep continuing, then what will happen? The septic shock. That is the main answer. A part, yes, here.
See here.
So yeah, that is a complication.
Asking about the complication, so I was confused.
Yeah.
Jyoti.
Yeah.
Part B mentions the treatment, and part C is a supportive care, and the part D is an advice after discharge. So the complication is mentioned in the class description part. The complication is not mentioned in the treatment part.
Pattern I saw in the cellulitis. Cellulitis text also I noticed the same pattern of question, like asking about the complication, but it's mentioned in the description portion. The we search in the other text, we won't find the same pattern. I think OET is using in peptic ulcer also. I noticed this thing. Yeah.
Because other paragraph mentioned the treatment, supportive care, and advisor.
Yeah, supportive care means critical, like ICU is critical.
Supportive care means some care means procedure or IV lines or
Jyotirindya, this is the four text we have, text A, B, and C. And A is the overview of the necrotizing facilities. That is the definition, then types, and then remaining all the things. Then this mortality rate, and these all the things you can see in the text A. The remaining is specifically given treatment, then supportive care, and advice you can see in the remaining text. And this overview and all the things we can see in the description. That means description types, and including this we can see the complication and all.
One more thing here. They didn't mention complication in any of the text except the description in text part A. Where it is enough, there is a description about necrotizing fasciitis, and also they given if it is not treated, there will be some complication. What is that complication? A septic shock.
Okay.
They didn't mention it is not direct question. You need to understand where the complication. Any of the text D says only care. It's wound care,
Yeah.
and also there is one more care, that is supportive care. They didn't mention complication. Where is the complication? They just mentioned in there. You cannot find any complication in there. They are telling how you can treat it. Hana, 1 minute. You can go to the text D, Nimi. Sorry, Mini. Can you go text D? Text D just after care. So after care, there will not be anything about complication, and also they will mention if there is anything, you can come to the hospital. That is 1.1 view they can mention. But text C, can you go text C as well? Here nothing mentioned. They just mention wound care and also supportive care. In supportive care, what are all the things you can give to support the patient? And they didn't mention what if it is not treated or if it is gone wrong, what will happen. They didn't mention any complication. Why are you confusing with the text C, Jayati?
Because I thought regarding the complication means critical condition, critical care. So
No.
that's why I was.
Oh yeah, imagination. So you can read that. That will be like as I think last session I said, there will be a level of questions. This is the level of question they have, like giving to you to solve. Whether you can understand what is the description. Description simply they are giving everything all together. What is it? If it is not treated, what will happen?
Okay, ma'am. Thank you so much. I understood.
Thank you, Jayati.
Thank you, ma'am.
And also all the synonymous or all the languages that they have used in the questions, you can see on your text A. May occur. Can you go to the text A and question if you don't mind, Nimi? Sorry, Mini. May ensue. Ensue means, it's a kind of vocabulary they're using, right? Varsha
Yes,
also
ma'am.
given.
Yeah.
No, Varsha
May
also given. Yeah, Varsha also given. The infection progresses rapidly, and they're asking what is the complication. What will happen if it is progresses? That is the complication, right? If it is not treating, if it is going on, what will happen? Patient will end up with the septic shock. When you are reading your question, you can find all the keywords surrounding your questions will be there in your part A. Sometimes you will have confusion whether the question in one text or question in other text. but you will not find anywhere that supporting sentences or supporting the are surrounded questions keywords. You cannot find anywhere else if it is not answered in text A or B. If you are confused with that one, if you are clear with your questions, then you can find the keywords are around the words. You can find synonymous or paraphrasing. You can find wherever your answer lies.
Understood, ma'am. Thank you so much.
No problem. Thank you.
Ma'am, we'll wait for the rest.
Is there any father's class today? I don't know.
But because live is going on here, so definitely father will come back, yes.
Have you tried to call father? That you just let him know you guys finished discussion. Or just text him.
My phone is off now. Cat.
If I'm calling also, it will not go.
Ma'am, let me try to call him.
Okay.
You are mute, Elizabeth.
No, she's talking. I think she's on the phone. Jayati. Thank you, Jayati, for sharing the task in the batches.
Welcome, ma'am.
Actually, he answered the phone, but I can't hear. Maybe because of the network issue. I just messaged him. We finished the discussion.
Here, those who did the task and you have any challenges faced, you can raise that in the platform now so we can discuss. By
Yes.
doing this, yeah. So
And
we
also
can
I
learn.
can see they're sharing them. Also, Mini explained that's a very good point. When you're practicing, you can practice with all the steps. Once you're competent, just go directly skim and go with your questions. When you're doing all the steps, then you will not find enough timing when you're having exams. It's to make you competent. So when you're practicing, you can do that one. Otherwise, don't do it in your exam. Okay, father also mentioned in so many videos. I hope it's clear.
Here, one question, if you go to the 19th one, the patient need to be aware of the need to keep glycated hemoglobin levels lower than. So we have here lower than. So we need not write the write again lower than. So we will be confused there. 7% we have to write, only 7%, not lower than. We have to avoid it. Okay. So this is usual
what,
mistake.
do not repeat the questions. If it is mentioned in your questions, you are mentioning again, it is a repetition, it will not give proper meaning. So you will not get the 1 mark for that particular question. It is also applicable for your listening. Don't repeat your questions as in your options.
Sometimes they will not give you this lower than. So then we have to write. We have to check it properly.
That is why we
Whether
need
they
a
are given or not,
proofreading.
and then write it. Yeah.
Yeah.
Even here,
When you're
32.3%. Sometimes they will give you in the word like percent already given. So we have to avoid that. We have to be careful whether they have given or no. We have to check. Here they have not given, so we can write that percentage percent simple. If they have given in words, then we have to avoid it. Okay.
no,
These
you're
are the
wrong.
common.
You're wrong, Jayati. Even if you need to understand clearly what is percentage, what is percent. When you're writing with a letter, it is called percent. When they are using it as questions, it is a percentage. Percentage
Percentage.
means, yeah, you cannot say 7%. Always you should mention the symbol when even if it is mentioned percentage.
We have to write percent, right? Percent.
Yes, when you're writing,
32.3%.
yes, when you're writing your answer, like for example, here 7%. Even if they mention percentage, you should mention 7%. Otherwise, your answer will be wrong because percentage is different. Percent is different. Percent always comes with a number, but percentage you cannot say 7%.
Yeah,
It
it
is
is low
7%.
percentage, high
Yes,
percentage.
yes.
Yes. Sometimes what they are doing is they will give that percent in words.
I think if
32.3.
father is here, it will be very, very good syllabus for father because he will give so many explanations in regarding this one. Before I came to this platform, I also having this confusion whether to write or not. And then he given explanation very clearly. You cannot go like it does not go with a. You cannot say like 7%. If it is
Yes,
mentioned in
percent.
your yeah, and also your questions will not be like it will not come like that. Hannah, careful.
Yeah, we can continue our discussion. The father is joining us soon. Yeah,
Hmm?
father is joining us
Okay.
soon. Yeah. Yeah. I
Any
noticed
other
this,
doubt
just
anybody has?
the same thing, Jyoti, your question on the complication. In our cellulitis topic and peptic ulcer and other two topics, I noticed the same pattern of question. By they asking about this, if we didn't treat that condition, quickly what happened? Like that, the same pattern question. I really fed up with this kind of searching. Then what happened? I saw one of father's video. I can easily point out to the description like that he explained. Then only I realized, this pattern is following by OET.
It's not a following, dear. That's what father always says. You can see whatever pattern, whatever questions father is taking from part B, C, anywhere. You can see in your OET. That's why father is insisting to practice authentic material because they don't
Yeah,
have
ma'am.
other patterns. They are having like same kind of levels.
Level, yeah, yes,
Yes.
the point is missed. The
How we
level is.
discussed, we know that this type of question will come in the description, isn't it? Because you also came across 2-3
Yeah.
questions like this, and now we know
Excuse
if
me, ma'am.
complication comes, most of the time, if it is not there anywhere else, we can directly go to the description. So it's thank
Ma'am,
you.
excuse me.
Thank you, Elizabeth.
Yeah, this same pattern question I faced during my exam time also. During the peptic ulcer was my, not peptic, I forgot the name. Pressure ulcer topic was there. While I read that thing also, I really confused. Then I realized in cellulitis topic, I faced the same question, so I just point out the answer easily.
Yes.
So, I
And
think this is
also
the
you
level
can
they
see
are.
the question like what complication can a patient suffer from if enough is not treated. All the keywords, if not treated, you can find in there. quickly enough means progresses. You can find all the synonyms from your questions around your answer. Otherwise, you will not get your answer.
Okay.
All the questions, that is why father is telling you need to write it down. How the question is making, how you can see the answers in your like lines. If you're writing the two things, like for example, if you're writing your question, if you're writing the two lines, you can understand how they paraphrased, how they taken as a question.
Yeah, ma'am. The listening also, I noticed these kind of
Yes,
things.
listening is
Yeah,
very interesting part
yeah,
in part A. You
yeah.
can
While
see
father
so
is,
many expressions in there. You can learn so many
yeah.
things in part A.
While I go through this step by step journey, only I really understand now these kind. Otherwise, in between, I watch here and there the videos. I really didn't get that not that much. But once I follow the step by step
Not only
learning,
you, dear. No one will get it. That's
yeah,
why
I
you
realized
need to
that.
at least follow the steps for few times
Yeah,
until you're competent, that you can see I'm competent, I can do it on my own, I just no need these steps for now. Then you can practice. Still if you're not able to do, then you go again with the steps. You can trying is good
yeah.
thing.
Today by God's grace, I managed to complete within 20 minutes, 12 minutes, 20 out of 20. But it's really amazing the strategies.
Good thing, Elizabeth. Practice
Thanks,
well.
ma'am.
The smile always it gives
It's
you,
really
yeah, OET smiles at you if you are giving a smile to OET. And also
yeah.
tell
Initially,
yourself
it's
you can do
very
it. Why not? You did your degree. It's just a 26 letters language. We are having more than that.
yeah, ma'am.
You can do.
Once every day learning these kind of things, like opening a treasure like that, I feel so it's really happy to. But once we stop at least 2-3 days not practicing, then again like lagging. But it's
Oh,
every
one
day
more
at
thing
least
I
1 week.
wanted to share here. Whoever, I think it is chief admin can do this one. I'm not sure other admins can do. If they are entering the names on the main platform, if it is the old one is there, then it will be confused. Better we can delete that one. Otherwise, they
But
will
it's
copy that one and then they will add their names. Then we will not have the proper thing which is going forward. I just noticed the list of who all are going to do for 1 week.
oh yeah,
So
ma'am.
this one,
Yeah.
there is a repeated one. So and also you can post a notice that who all are filling, then they should delete it. What they are the next person filled, and then they can delete their own. Otherwise, it will make
Oh,
confusion.
okay,
If you are filling
okay,
it,
that's
and also there is another person taking it from your, and then you can delete your own post. Otherwise, it will make
the
complicated.
in the main platform, right?
Yes, I
Yeah,
just
in the other
noticed that
groups,
one.
I'm
I can
deleting.
see
No,
so
no,
many notices.
yeah. Today, I think today in the evening, father said, okay, and because of that, we are not going to post that 1 week list to the main platform because almost all people now join back to our discussion group and a special group. So
Oh, that's enough then.
today, yeah,
So you will not have
today itself we
confusion.
are, yeah,
Even
today
in your
itself we are
own
not
group, if they are just doing it, whoever admins, they can delete it.
Yeah, but, now I'm doing the thing. Otherwise, it's a bit messy. Some more thing is like if you didn't give 1 week slot, it's not easy for the candidates to take. No, then
Yeah,
we cannot identify the active people.
I know.
So, yeah, they are taking the slots and some new people they are already taken the slots for Wednesday and Thursday and like that. Then they are preparing PPT now itself. They personally message me and ask me how to prepare the PPT and asking for the video or things. Then I share it early. Otherwise they cannot.
Okay.
Sister
So we,
Elizabeth, hello.
yes,
Can I
dear.
say
Yes,
something?
dear, can.
Yeah, even
Can.
me too. Finding some time confusion, okay, because about that slot.
Yes. Which one is the present one? Which
Yeah,
is the past one? We will
yes.
not make. Yes, it will make
Music.
confusion.
So from my side, I would like to request like you have given advance also for 1 week or something, 2-3 slots. So I think it will be difficult because duty also we have like some time duty also not fixed. So our duty schedule is sometime changing. So it's difficult, no? Like I think when we have the session after the completing the session, you can ask. I think who can take the slots for tomorrow, like that. No, it will be more convenient according to my opinion. Okay.
Okay, dear, I can understand. But you know, if you think
But it
about the
will be
new
more
aspirants,
difficult there because
yeah.
she will be here today, but she will not be there tomorrow. But if she is not there, then the slot will be empty if she wants to do. If somebody is not in today for the discussion, there will be tomorrow. So it's going to be difficult again. So it's better. Maybe if she wants to do that, she knows that she's present tomorrow, then she can raise a request. I'm available on this date, so just give me a slots on that day.
Yes, yes.
Yeah, you can just request, but if we are going on asking, oh, come forward, no, it will not work out because you know that you are having duty today or tomorrow, whatever day.
Yeah.
But again, you can do tomorrow, but somebody also wants to do tomorrow. Maybe they will not be here today. So if we are posting it there, if you are in a group, then it will be easier. But if you are not sure, you can just ask, I'm on this day, please, I need a slot. Just preserve for me, like today or tomorrow. Just text them, then they can hold 1 or 2 slots for you.
Yeah, the
Okay.
one from past request I already edited, you know, I already reserved the slot for you.
Mm.
You can see in the, yeah, she already messaged. Then someone like, you know, if the people copying the message, just try to copy the latest one because some in between from there they are copying.
That's what I'm telling.
Then
That's what I'm telling. I know these difficulties.
yeah, what I am doing is I'm writing, all in the individual slots and writing
Once
manually
we'll settle,
and
then it will
sending.
be fine. Until
Yeah,
we
it's
just we
angle
just
settling.
starting
Yes,
now.
yes.
So after this week, you will be fine.
Yeah, I'm so happy to do that
Yeah.
also, but even yeah, but so we just stop sharing in the main platform since we add today. I think we add Sash and Jinsui, one Varsha, Samjana, all to the active people to the discussion group also, so they can choose from the discussion batch also. Yes, the action is back.
Good evening, Father.
Good
Good evening,
evening.
Father.
Good. My absence will help your discussions, right? Yeah, that's great. It's actually a discussion session. Any concerns that need to be addressed? Not clear? The thing is, you have to discuss, otherwise you won't get the real tips. I may not know what are your confusions, right? So I believe that you know these things, so I may not repeat it again because I have taken at least some 25 plus sessions on reading part A. Any concerns you have from this particular material or any general
Father.
concerns regarding reading part
Yes.
A?
Yes, Father. In this, we had the discussion on question number 10. So now it
Okay, if
is
it was,
clear.
it is clear, no issue. If
Yes,
no,
Father.
anyone while practicing, if you had any other issue, for example, people have said, okay, I got 19 out of 20 in 9 minutes. One question was wrong. So if you don't understand, even after looking into the key and reading again, if you don't understand, you have to raise the subject here. And also in the discussions, when you give the feedback, it would be better to say which was your mistake. One mistake you had, right? Out of 20, your score was 19. Question number 13, I made a mistake. If everybody posts that way, I can analyze and find out, oh, this particular strategy they haven't understood, or this particular problem they have, because many are missing third question 13 or 14 particular questions. So in general, I can explain in different ways. Do you understand? So somebody can take the initiative to collect and say, today, question number, which are the mistakes? Maybe all questions may not have mistakes. So out of 24 questions were the mistake, 14th question mistake by 7 people. 17th question mistake by 2 people. So if you can just mention it, it will be easy for me to analyze and give you exactly what you require. And as I said, don't confuse. There was some question to me personally, I believe. Let me share my screen. Regarding the steps, don't get confused, okay? Can you see my screen?
Yes, Father.
Yes, Father.
At YouTube. At YouTube, we can type in as well if you have some doubts, okay? Give me 1 minute. Yes. You could do this in right. Yeah. See now. Now, if you have gone to Necrotizing Facitiis today's, there were only 4 steps, I believe. Right? Am I right?
Yes,
Did I explain
Father.
4 steps or 12 steps?
4 steps, good.
Yes, Father.
Okay, so these are the 4 steps. But earlier I have explained in detail about 12 steps. So if you find these 4 steps challenging, what you can go to the earlier videos, which will be uploading as episodes. Maybe next one, I believe, 20th one, diabetes must be 12 steps. This is like these same 12 steps are summarized into 4 steps. What are the 12 steps? Identify 4 text headings and write down on a piece of paper or your notebook, wherever, the text headings. As you know, if text headings are not given, where do you find the text heading?
First
Read
line.
the first line, topic sentence, first sentence or first line. You will find the topic that already you know from the paragraph analysis. That's why I said the 1 to 37 episodes are mandatory for anyone, because that includes all these general tips for all the subtests. Second step is understand the relationship and sequence among the 4 headings. There will be something like treatment assessment or procedure or description. For example, I imagine something like consultation. Okay, you consult the doctor, then you have diagnosis. Okay, then you have treatment, then you have management. You will not have management first, right? Without consultation and diagnosis, you cannot have treatment. So there is a sequence, there is a relationship. As somebody mentioned regarding part C, we were teaching that new method now. And it's a very old method, but we're repeating it now. Like for newcomers, it's a new method where we have sequence connection between all the paragraphs. So also here, connection between these 4 texts, one theme, 4 texts. So all the 4 texts are connected to one theme. That sequence, if you understand, it's very easy for you to identify the hedging words and locate the answers in a particular text. Third one, skim the 4 texts, highlight the clues. Skimming just by using, in the beginning you can use 30 seconds, otherwise just 20 seconds will be cool with each text. Just skimming, just going, glancing through, jumping from point to point. Skimming what? Title, section, headings. Today, what was the topic today? Necrotizing Facitiis. Yeah, Necrotizing Facitiis is the title. There is a main title of all the 4 texts come under that particular title. Then section headings, that's what we said, 4 headings for 4 texts: text A, text B, text C, and text D. And after that, subheadings. You might have 2-3 subheadings sometimes. In one small text A or B, you might have 2-3 subheadings. If you have no heading and you have 2 or 3 subheadings, maybe you can collect the main words from those 2 or 3 subheadings and create your heading. So to create the text headings, there are 3 ways. One, you will be given a text heading. Just write down on your notebook and every page of the question booklet. Then second method is read the first sentence, topic sentence, and you will find the heading there. Third method is that if you have subheadings, or I can say first one subheading given, write down the heading. Second one, if you have subheadings, just take the main words from the subheadings, 2 or 3 subheadings. You can create a heading or you can understand the heading. Third method is read the topic sentence. You will get the heading. Fourth method, if at all there is no topic, if you are not clear about the topic sentence, if there are sub-paragraphs, read the first sentence of both the paragraphs or 3 paragraphs. Did you get it?
Yes.
Okay. So this topic heading is only for your convenience. Just to understand, this passage contains this. These are the contents of this paragraph. Okay. So don't worry about the clarity or grammar or the style of the word, vocabulary, and all that. Then you have names. As I said, names are the wonderful things, and everyone loves their name. So names of different things. What are the names? Names of
Drug
The
name,
organ, device,
organ,
disease,
device,
disease
condition, condition,
name of the medication,
test,
Body.
short
yeah,
forms,
body parts.
abbreviations,
Yeah, what is that?
Abbreviation.
further abbreviation,
Abbreviations, symptoms, all those things. Then numbers can be, names can be of the organizer or anything. Then number and percentage. Then sequential expressions.
expression,
Then frequency expressions, often, rarely, randomly, scale, adjectives, negative expressions. Okay. And the fourth one, read the question statement, highlight the hedging words. Now, the third step was to skim the text and highlight the clues. What are the clues? These 10 clues. 10 may not be there. Mostly you will have actually title, section heading, subheadings already over. Then it will be names, numbers, and usually adjectives. Names, numbers, adjectives will be majority answers.
Conjunction. If there is a conjunction, then there
Conjunction,
will be
yeah. Yes. So fifth one is read the question statements and match the text. Now you have read the questions and highlight the hedging words. Now you have to match the text in front of every heading, 1 to 20, not only 1 to 7. And while practicing from 1 to 20, you have to write whether it is from A text, B, text C, or text D. Not only for 1 to 7. For practice purpose, identify, looking at the hedging keywords, main words of the question, identify from which text this comes from. Okay. Read the question statements and match the text. Then sixth one, write down the hedging words identified in the questions. You underline the hedging words in the question, write them down. Arrange the hedging words into 4 columns. Make 4 columns in your notebook. Text A, text B, text C, text D. Under each text, you can make 2 columns. One column, you write the hedging words from the questions. Another column, you write the hedging words from the text or the synonyms, if you want more clarity. Okay. Hedging words. And then write down the hedging words identified in the questions. Step 7, arrange the heading words into 4 columns. As I said, you create 4 columns. Write the hedging words you found in the questions into 4 columns. Confirm 1 to 7 answers, just to match the heading. Sorry. Then locate the answers, that is 8 to 20. Write down answers in the answer booklet, then proofreading, fill the self-assessment form if you need to be assessed, okay? And send it to me. That was 12 steps. But now at the later stage for the advanced people, we have summarized these 12 steps into 4 steps. All the 12 steps are included here. Skim the 4 texts and write down a heading for each text. Second one, skim the 4 texts and highlight the clues. Third one, read question statements 1 to 20. Highlight the keywords and match each question with the related text. Locate the answers in the text 1 to 20. Okay. These are the 4 things. For example, here there is no heading. This is from aspirin resistance. How will you find the heading?
In the topic sentence.
Topic sentence. Resistance. Aspirin's resistance.
Description.
Yeah. Means here it will be in the head. You can see the text, right? At YouTube. Yeah. Here you see, in the last few years, the concept of aspirin resistance has been largely emphasized in the medical literature, although its definition, mechanism, and specific guideline for its management remain unclear. Okay, the concept. The concept means it's a description, right? It speaks about description, means describes the concept of aspirin resistance. That's what I said. If there are no subheadings here, no heading here, then you can read these also if you don't understand. Various laboratory parameters. Okay. Speaking about laboratory tests and parameters. Few studies have reported, few studies. That speaks about the results of few studies. See, further, clopidogrel, right?
Resistance.
So, clopidogrel is a name, so that's going to be important. So, you can put it as the heading as description. Main heading is?
Description.
No, main heading, title?
Aspirin resistance.
Aspirin resistance.
Aspirin resistance, yes. So, that should be in your mind always. So, this is a main heading, sorry. This is a subheading or the heading of each text. Okay. Then going to next. Here you have a subheading, text heading.
Mechanism.
So what is the mechanisms of aspirin resistance? So you can take either mechanisms, whichever you understand, or aspirin resistance, whichever is cool for you to get the idea. Okay, you can choose any heading. So the exact mechanisms are not clear. Through aspirin resistance, you see, now they are saying through aspirin resistance. So which will be better? Aspirin resistance will be better. Okay, mechanisms are not clear. They are not mentioning is. So aspirin resistance, the proposed factors for this type of resistance include. What are the factors for resistance? Okay. Then, you know, when you skim, you have to look into these things.
Abbreviations, name.
Yeah. Names, abbreviations. And definitely you can find answers somewhere around this. What is this? Transplant formation and COX. Anything of this sort, you have to highlight. That is 20 seconds highlight. Okay. You have here something.
Taxative.
Conjunction also we have to find. Or and.
Or where is or?
Or is here. Cells or vascular cells. Blood cells or vascular cells.
COX to the
above number?
Five.
Tell me the number.
4 further. 4.
4.
And fifth also.
Blood cells or vascular
Blood cells or vascular cells.
Fifth also have other cells.
Or other cells.
Fifth
or other cells.
Okay. Cool. Highlight all those things and run within 30 minutes or 20 minutes. Depending on the speed you practice, you will improve your speed. Next one, you already have a
dosage.
Text heading, aspirin
doses.
So you need not worry. So what it will speak, this paragraph will speak about dosages. So you have to mind dosages. Correct?
Yes, sir.
mgs per day.
40
Yes,
names.
77, 50. First line.
Yeah, 72 versus mg. You can also
40.
just highlight, yeah. Then 14 mg.
40.
Yeah. So dosage means ultimately, even if you don't highlight, this one is also cool.
Just down. Last line.
Like aspirin, you do not highlight also if you want to make it cooler.
Last line. And last second line.
325 mg per day.
Yeah, 355 mg per day.
1,000.
It doesn't mean all these will be answers, but you know, numbers are there. Immediately you can locate when you come back, right?
Yes.
Yes, Father.
And also while reading the questions, you can understand. Then coming here again you have management. So you need not worry, already the text heading is given. Management of what? Aspirin resistance. So think of something, what is management? Okay. What becomes important in the management? Okay. Other method, sequential expression. No? There is one more method they are speaking about. Capri, the the abbreviation. Then numbers you can highlight. Sorry.
However.
Yeah. However is there till date. Not clear, all those things. Research too. Although I see there is a combination of
And aspirin.
However, yes. So just look into whatever, then go back. Now you have this sequence, right?
Yes.
This sequence you have. Description, resistance, dosage, management. You can take aspirin resistance. I did not take it because aspirin is there, common topic, right?
Yes.
That's in your brain. So description of aspirin, aspirin, that is the concept. Then resistance, aspirin resistance. Then dosage, aspirin dosage. Management of aspirin resistance. So let's see. What are the hedging words here? What are the factors of the true aspirin resistance?
Factors.
Where it will be?
Resistance, B of
No?
Factors BA.
B.
Some 7 factors they have mentioned in B text.
B, Father.
B, okay. One sec. One sec. Yeah, factors. Now let's see. B, you mean B, right? Resistance, okay. Let me type here if I can. B. Okay. How much of aspirin completely inhibits COX enzyme?
Inhibits COX enzyme.
Inhibition resistance only, Father. B again.
No.
B.
What is keyword here?
How
The
much?
key
How
emphasis.
much?
How much?
Completely
Key
How much?
emphasis. How much means
Those.
Number.
number, no? There should be
Number,
dosage,
Father.
right?
Yes, Father.
Those.
Dosage.
Dosage.
Yeah. How much they are asking? Stress is there. How much should I give? How much of aspirin completely inhibits this one? Then what will happen if aspirin compete with other NSAIDs?
Interactions.
Compete with other NSAIDs. Other
Dosage. C.
C dosage.
no. What will happen if compete?
It's
Must be resistance, I believe. What will happen?
D.
What will happen means result, right? Not dosage, probably.
Management, Father.
What will happen if aspirin compete with aspirin?
Sorry, give me.
Compete means the interaction, right, ma'am?
Yes, I think interactions.
Yeah, compete means interaction. So which one you feel?
Resistance, B, Father.
Is it resistance? I'm not sure. You'll have to say. Interaction. Copy means interaction with other NSAIDs. Let's see how the true picture of aspirin deficiency is revealed.
B.
True. How the
B,
true
B.
picture?
B.
How?
How and true picture?
Description.
We will
Description.
B,
True
father.
picture. So B
B.
father. B.
Okay. Then what are the parameters for assessing the efficacy of aspirin?
Dosage.
Assessing.
Efficacy.
Efficacy. Dosage, right?
Yes, father. C.
Let's check. 6. List the methods to manage aspirin resistance. Methods.
Method. Manage.
Manage is there already, right?
D father.
D.
Manage.
Management.
Manage.
Management. D.
Is it management or any objection?
No.
D.
Whether true aspirin resistance is a clinically relevant phenomenon.
True aspirin resistance.
A.
B.
B father.
A.
Yeah, I believe. I don't know. We'll check it. Don't worry. Okay.
Yes.
So, that's what we said. Let's see. Next one. How much mg of aspirin is minimum required to complete inhibit coaxial enzyme? How much?
How much mg? How much? So
MG.
dosage. Dosage
C.
father. C.
mg is there. So
Dosage.
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 C.
See how easy it becomes. That must be a number, right?
Yes.
Answer must be a number, right?
MG.
Yes.
How much?
Yeah. Which patient show inadequate inhibition of TXA2 biosynthesis by aspirin?
B.
B. Resistance.
Which patients and
Yeah. Let's see. Name the antiplatelet agent used to manage aspirin resistance.
manage.
Manage.
D.
B.
In the initial stage, you may find a little confusing, but don't worry. It will be cool with practice. Okay. B, right?
Yes,
B.
father.
B father.
D. Okay.
D.
Yes. Let me make it small. Yes. D. Then what are responsible for transcellular formation of TXA2?
Resistance.
D.
B.
What are responsible factors? B.
D.
B. Resistance.
Father. B.
What are the responsible for transcellular formation of TXA2? See, here you have, yeah, easily you can locate there. You mean B?
Yes, father.
B. B.
What is the daily doses?
Daily doses. Dosage for
C.
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 C. Yes. Daily doses. Yes. Then 13. Which trial has shown greater benefit of combination of aspirin and clopidogrel? Am I wrong?
Combination of aspirin.
C.
C. For dosage.
C. Doses.
C. Okay. It's only for practice. Okay. Later you need not do these things. 4th one, aspirin displays good dash activity.
Description. Maybe father.
Description. A, father.
Description. A father.
Go to the last segment. Few studies have reported aspirin. See, studies we have highlighted,
Studies.
right?
A father.
Aspirin. Yeah,
A
studies.
father.
A.
Yeah. A. Yes. And TXA2 may be produced by aspirin insensitive nearly platelets. Which one?
B.
Father.
Resistance.
B. And you see this particular one is repeated 4 times, I believe. This abbreviation. Okay. Increase in the dose of aspirin.
Dose of aspirin.
Doses. C.
C.
Say C. How beautiful.
B. 18B.
In 18, inadequate inhibition of TXA2. Say again.
B.
Inhibition, resistance, B.
Ibuprofen therapy and
Dash by aspirin can be seen in patients in ibuprofen therapy.
Management.
Management.
therapy.
Management.
B.
D.
B. Resistance.
B or D. There is a doubt. Let's
B.
vote.
D.
Let's vote
I
it both.
think
B.
19. First step in
Okay.
management.
19. The first step in now you
D.
see, even if you make a mistake here, that will fix in your brain. The skill will be developed as you go there. You will understand. Okay, this is not from here. Then next time you will be more alert. This first step in management of aspirin residency is to unique about the patients. Which one?
D.
Management of aspirin resistance is to inquire about patients. A.
No,
The first
D.
step in management.
First step in
Is it A?
management. D. D further. The
The
combination of
combination of dash with a
C.
clopidogrel. See, this name is there
C.
3 times, I believe.
clopidogrel.
C.
Combination, interaction.
Dosage, Father.
Which one?
C.
Let's check now.
Yes.
Yeah. Now, eighth one, C. How much mg, dosage. Inhibition of TXCA2 medicines by aspirin. C again, dosage. Then the other you said manage, D. Word manage was there. B. Formation of, again it is this one. C. Daily doses, again dosage.
C.
And the combination of aspirin, clopidogrel. So that is management. Then aspirin displays good antithrombotic activity. So that is A. We predicted it correct, I believe. Okay. Let's check this one. 15th one, studies have reported, you said studies A. Aspirin insensitive. B. Resistance. Insensitive means synonym of resistance. And C. Dose of aspirin, again dosage. C. 18. Ibuprofen therapy. That is dosage. C. And management, again D.
D.
And D. Combination with
C.
clopidogrel. Okay. I'm not dealing with it in detail. Just to tell you, we'll go ahead with some steps and go last because it will be too long for you. See, now you can practice this way as well. Okay. Take the answer key, write headings everywhere in every page. Okay. This heading, description, resistance, dosage, management. Then take the clues. Now you have to tell me question 8. This is not required. Math heading. Question 8. Which clue is applicable?
Number 8.
Number. Yeah. Number. Then 9.
Dosage or
Ibuprofen therapy name.
Name of
Yeah, name it is.
Third.
Then
10 name.
ibuprofen.
So
10
name.
one.
Again,
Name.
name.
And 11th one.
Name. Aspirated platelets.
Name.
That's the name, no? Yes.
Number.
12th one.
Number.
Abbreviation.
Number.
13th one. Abbreviation. Name or abbreviation.
Abbreviation.
14 names.
Name.
14.
Name.
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 15 numbers. Person.
15 number.
Number.
And person.
Abbreviation.
16.
Cox 2.
16 numbers and percent. Yeah, both are there, right?
Abbreviation and number.
Abbreviation.
16.
Abbreviation and number.
Abbreviation. Yeah. Abbreviation or name, whatever you want to. Or abbreviation.
Name 870.
Yes, then.
Name.
Cardiovascular death. Name.
Cardiovascular death.
Name.
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 Biosynthesis. Name.
Biosynthesis.
Name. Compliance.
Compliance.
Name.
Name.
Verb adjective.
Compliance is not name, right?
Adjective.
Adjective. Adjective, right?
Adjective further.
Compliant people, right? Compliant patients.
20
Yes.
is name.
Name.
Aspirin drug.
Name. Name of your drug. See how many names? How many numbers?
1, 2, 3, 4, 5, 6, 7,
10 names. 10
Yeah.
names.
So this is how you gamify the whole business. You will enjoy it. Then you will convince yourself. Then just to pass, you need only name and number, nothing else. Just to get 350 or 400. If you don't require anyone you see, it will be name and number. So at least go, just skim, and in the one round, you can get correct at least 15. Just name and number. 7 you will do within fraction of seconds, this 7. Then what you have is 13. Out of 13, definitely 8 you can do within fraction of seconds. That's why even the beginners now, they are getting it. Today, many have done it within 10 minutes, getting a score of 19, 18. It doesn't mean, don't worry about the score. Or do all these gymnastics. Make columns. Maybe one portion of the notebook, keep it like these columns. No? If you have practiced 10 part materials, you can make a calculation, then total, how many names? Write all the total names here, numbers here. At the end, out of 10, 200, 160 names. Okay? Or 110 names and 60 numbers. Then you get convinced this is going to be. That's why I have taken stress on name. In the episodes, name tip I have stressed than other things. And the other day I have shown maybe more than 25 questions from authentic materials, from every material with name, part C. Do you understand what I am telling you here? Okay, then write like this. Description, which are the questions? 4, 5, 14, 15. Decisions, first question, third question, 11th, 16th. Dosage, the second one, 7th one, 8th one, 9th one, 12th one, 17th one, 18th one. That's why you have so many dosages as answers. Dosage has got 3, 6, 8 answers out of 20. And management, 4, 6, 10, 13, 19, 20. And write down these names, these words. Learn the spelling of each answer key. Then you will see there is a particular model of making questions. If you go through the experience sharing, you can make out. Some people have said, one girl, first attempt, she studied only here. She completed within 7 minutes. She says only 6 minutes. And she got 430. And she says definitely 20 out of 20 in part A. And the funny thing was that she was again reading, proofreading. Everything she finished within 10 minutes. Then she was sitting like that. Then the examiner was strangely looking at her, thinking that this Buddha knows nothing. Okay. But we are told them to enjoy what others are struggling to complete in 15 minutes. Did you read the message today I posted in the main platform? Many messages I get. Sometimes when I read, when I was posting, I got it. What was the message? Let me check. See, good day, Father. With your strategies, I tried out reading part A sample test and managed to complete it in a space of 9 minutes. I got a score of 19 out of 20. I went back to the one I got wrong and identified my mistakes. I cannot thank you more because of okay. She is not very advanced student as I know because I see them recently in the platform. Okay. If the person has understood the strategies and done it, she will definitely get 20 out of 20 without any challenge. And next one was In part A reading, I got 17 out of 20, and if I only follow the further strategy, my score will increase. Is absolutely fact. So many messages I get. Now what you have to do, you have to post this response in the platform and tell me, you said you got 17 out of 20, right? Just mention the number, my mistake. Question 9, question 12, question 16. Next person says, my got one mistake, question 16. So if somebody can collect and give me, I can analyze clearly and tell you what mistake you have, what problem you have, or where you lack in your competency. You understand what I'm saying?
Yes,
That's the
Father.
real learning. That's the real learning. I may not be able to search always because since you are interacting, immediately somebody can collect, right? There is nothing. You can even write in your notebook, okay, 18 mistake, tick 1, 18, tick 1 tick. Then if somebody else got second tick, or write the number 1, 2, 3 in front of 18. So that analysis will help you more so that I can focus mainly on that particular aspect of language where you have a difficulty. Did you get the sense what I'm trying to put across?
Yes, Father. Yes,
Yeah.
Father.
Hope somebody will do it. We want you to do that. No, that's how you learn. When you do that and you get a clear idea where people are making mistakes, where did I make mistake? When I explain, you will understand because you have an idea what were the mistakes of different aspirants here, right? It may not be a long list because only active learners will share and only they will pass. Others will be enjoying at the background, but they will never improve in their competency. They will appear and reappear, and after 10 appearance, they will come back again to EduSkills. That's our experience. Yeah, when I tell them, they don't understand. Why should I do? You might have read all those experience of recent people who just completed their discussion experience under Mini and Nitya admins, you know. But very few have participated in that. Here also very few are there. Majority enter after the discussion to attend my session. But I tell you, results will not be very good. Okay, because practice is important. When you discuss, you understand. And be open and practice. Okay, take down and post like this, no? Post this way. Create like this and post it. A screenshot. You can just write down and take a screenshot and post. That gives a clear idea about for even beginners. No, give the headings, the key answers, then what is said. You can mention here also in front of the answer, you can mention description, resistance, or A, B, C, D. Then say what are the clues. Just write the heading as this column clues. Okay, serial number, answer key, clues. And if you want, from which text. And you can also add a clue from the text. What was the synonym used there? Anything to ask? Because if I have the details, all the PPTs and all that. But if you go in detail, it will take a lot of time. If you want just see, so I will come here. First one, text A, name, right? Aspirin. Then adjective various, name, medication, aspirin. Then you have a number here, percentage here. Okay, B, you have name, medicine, ibuprofen, name, medicine, aspirin, name, NSAIDs, name, thromboxane, name, COX enzyme. So all these are answers. D, C, you have name, medication, aspirin, you have number mg, number 100 mg, then you have scale, higher doses, name, medicine, ibuprofen therapy, name, lipid, adjective, name, medicine again. All these are the answers. I don't want to explain it in detail. See, sequential expression first, other method first and second method, aspirin name, clopidogrel name. Hope I am pronouncing it correctly. Otherwise, just pardon me. Can't help it. Yeah. How beautifully. Instead of practicing so many materials, try to make these columns and gamify it. Your brain gets gamification. You know, even I tell you, I can challenge you. If I get the students that are all abroad, I can tell you when I was the director of the college, I used to tell them, degree students, it's a criminal offense to read the lesson what I do again in your as a homework or before your exams. No reading, because we call it experiential learning. We gamify it, we understand it, we sit in our permanent brain, permanent memory. That's possible. And they have done it. And we have told them previous day of the final exam, semester exam, they have to go for a picnic, get into the water park, and get exhausted, come and sleep 8 to 10 hours, get up and smile, and enjoy some breakfast, and go cool to the examination hall and write. You'll do better than reading whole night. We call it registering in the permanent memory. So hope I can see some like active learners. We'll share you some 20 or 25 materials, authentic materials of the reading part A. Others we don't feel any use because we are not going guided practice. So if you are an active learner, either you are in the special batch or discussion batch, somewhere you will be there. Okay. Then you can create these charts. Better than this. Okay. I did not have time. I just created as you are discussing. Okay. You can create better charts. You can gamify your own way also. This is to convince your brain. Once your brain is convinced, that analyzes better. Name, all those things, no number and all those things. And when you match the text question hedging word with the text, don't worry. In the initial stages, you may get 10 or 12. Then gradually it becomes 15. Then gradually you will find all the hedging words connecting to the text. Come on, anything? Exhausted? Since you have no stamina, I did not explain this. Otherwise, I would have explained. I didn't see a smile in your face. There was no smiles. All were like, when will we stop?
No,
yes.
Father.
Not exhausted, Father. It's very nice.
Trying
Taking
to listen carefully.
And you know, say with all these and more details, maybe each A part into 45 minutes, 1 hour, maybe that particular thing you can see diabetes, maybe 40th, I believe, 39th or 40th. Anybody remembers? Diabetes.
40.
44.
And you can just watch that. The original one is there in the playlist, reading playlist. You take the first one with a thumbnail shading 150 plus or something like that views. That has got more than 170,000 views. And that's the best thing for you to understand how distractions can disturb other people. I edited maximum distractions, but still continuously there was distractions. That was the first ever session we took in Zoom. Yeah. So you can see so much distraction because the main thing is like beginners, no, they didn't know how to use Zoom. They didn't know how to mute. But there itself, you can see all these steps. So you must reduce the steps by yourself as you go on practicing. And at the end, no steps at all. You simply skim, go, answer. In the exam, no steps. Just go, skim, and answer. That's all. Within short time. And you get different question booklet, and the text booklets are different. So you need not scroll. You can just keep this side and that side and simply mark. And this is exam below matriculation level, okay? Below 10th grade level. And I can challenge you, anybody in CBSE students, you give them, don't tell them it is OET and all that. You give your C part and all that, definitely they will score more than 35 without even knowing what it is. High school students. One of our students' daughter has explained how she got 36 in the first attempt without knowing anything. She was in 7th standard studying in Mangalore, St. Agnes. And her mom was taking a mock test. I asked her to give one copy to her. And she did. Mom got 29, who was practicing OET for 3 months. Daughter never knew what is OET. 7th standard girl, she got 36. And she has explained, there's a video in our platform. She has explained how easily you can identify the answers in part C. Here, the biggest enemy is OET aspirants. If somebody loses the exam, they will start saying, oh, no, but nobody will get it. Minimum 3 times you have to attempt. Everybody fails. You know? So everybody gets into the brain, oh, OET is so challenging. You can't get it. You can't get it. There are so many people who tell me, Father, please pray for me. I have booked 3 dates. I have booked 3 dates and this is my first attempt. Then I tell them, sorry, I can't pray for you because you have paid so much money for 3 attempts. Now, after first and second attempts, when you attempt 3rd time, you tell me I'll pray for you. Because you have decided not to pass first and second attempt. That's why you have booked 3rd date as well. Yes. Anything else? Anybody wanting to come to this one, Zoom and interact directly? I'm posting the link there, okay? Everybody please like before you leave, click the like button. And if you love, get a super chat just by paying 10 rupees or whichever you want to. It's not money, but it helps reach. Let everybody benefit because these days you have to reach to maximum people, okay? Because you have started real party, you know? And everywhere in the platforms mention if they say they are beginners, tell them or tell them to reach out to those 1 to 37 episodes. As they go on with these sessions, attending these sessions, they should complete that as well. Otherwise, they may not understand many things what we are saying here, topic sentence. When I say topic sentence, what do they understand? Right? Like in today's video, you found Ganesh saying feel. Okay? So you should be able to feel it. Yeah, you can teach if you have high school kids and all no, around you, you can teach them. Take one paragraph from that text and feel it and show them.
I'll take one paragraph and I'll take a video and I'll send you for the peel method.
Yes. You can always do it. The more you do it, better you understand. You know, brain gets trained in analytical skills, analyzing the paragraph. If that is done, your reading becomes very powerful. Not only for OET, even when you read even the newspaper, it will be very powerful. It grasps, you will grasp better and faster. And as we have seen in the admin panel, we will be like maybe next generation small contribution will be doing once in a week sessions for the kids. I've asked the people, this is a bonus for admins. Maybe if admins want to accommodate some of the active members, you can decide. Okay, but then first we'll have a parents training for all. Common, it will be session will be very common. It was being asked long back, maybe when before 4 years they started to ask. We want sessions for parents and kids. So we thought we'll slowly start one. Yes. We can make kids, if you manage before 14 years kids, if you try 1 year, then you need not bother about their studies at all. Till any stage, if you really spend time with them for 1 year and practice what I say, I can challenge. The study becomes, they fall in love with the study. Then we gamify their studies and their brain enhancement, everything will be done. You can also see if you are interested about the kids' math skills, you can find so many videos in the same channel because this was earlier kids channel, then we shifted to OET because we had to upload OET somewhere. So we started to OET. You can find it somewhere. Let me check. Have you seen those kids videos?
No, Father.
I'll
No,
show you one.
Father.
It teaches you many tricks, small tricks. Kids are teaching you. My kids whom I taught in their own home. Let me check if I can find it here. Video channel. Videos. I remember that must be in this channel itself, right? Give me 1 minute. In the meantime, you can discuss something. What did you learn today? Actually, our practice was that at least 3 people summarize something new that you have learned. But now we disconnected to that, those practices, very powerful practices.
Ajay, Edu Kids Junction?
Kids Junction, no, this same, I believe, is it there? I don't know. I'm just looking into this particular, our EduSkills channel earlier in the beginning, maybe.
EduSkill English Action Time with the fun rhymes.
I'm sure that must be English. It must be here in the initial stages. So many videos to search. I don't remember what was the name given. That's why I have to scroll. Somewhere. Yeah, here it is. I'll show you one sec. In the initial stages, maybe I can collect and give you what is it? Yeah. You'll find. Can you see this video thumbnails? Below P. Below P. Is it visible?
No, Father. Yes, Father.
Yes, Father. Yes, Father.
Yeah. See there, those are there, 3 there. Then you have many before that. See, all these kids explaining, these are all online classes.
Father, this is started during COVID time, huh? COVID pandemic.
Yeah, COVID, yeah. All these are COVID time. See now, let me enhance, if I can enhance one sec, the sound and video. I'll show you how they do it. Calculations, tricks. Share. Sound of now you just listen to this simple small videos there. Let me know if you can hear, okay? It is audible and visible. Audible and visible, right?
Yes, Father.
Yeah.
Hi everybody, I'm Anna Rosino. I'm studying in 7th standard in SH Convent School at Chengalam. I know that we all face some difficulty in multiplication and to find the square of sum. But now, I'm here with some maths trick. Let's move to the examples. Now, I'm going to show you how to multiply any number by 10. Our first example is a 216. Let's move to the examples. We want to first write 16 into 15. 16 into 15. Then we want to add a 0 to 16. That means it will become 160 equal to 160. Then we got the answer as 160. Want to divide 160 by 2. 160 divided by 2. we got that 160 divided by 2, it will become 80. Then we need to add this 116 and 18. 160 plus 7 plus 1 is 6. It's 25. We need to means I'll show you one example. 25 square. First we need to do that. It is a square of 5. We all know that it is 25. We need to write here as 25. Then 2 plus 1. It is equal to 3. Then we want to write 2 into 3. That means 6. So the square of 25 is 625. Next 75 square equal to 25. We need to write here 25. 7 plus 1 is 8. 8 into 7 is equal to 56. 15 square. What's the sum of 50? Square of 5? It is 25. Then 1 plus 1 is equal to 2. 2 into 1 is equal to 2. Then the answer will be 225. Next example. First of all, we can take 2-digit number. Now I'm going to show you how to multiply easily. First of all, we can take 2-digit number. We can take 12 into 15. How we multiply it normally? We write it as 12 into 15. 5 twos are it's 10. Carry over 1. 5 ones are it's 5 and carry over 1. It will become 60. Then 1 twos are it's 2 and 1 ones are it's 1. Then we need to add this 0. It will become 8. Then the answer will become 118. But it is normal method. But it will take time. But I will say you a very simple method to multiply any number. We need to write it as 12 into 15. Then we need to multiply 2 into 5. That means it will become 10. We want to write only 0. Want to avoid 1. Then want to write 1. Then we want to do cross multiplication. That means we want to say 5 into 1. That means it is 5. Want to write below 1. And 1 into 2. It's 2. Then we want to add this both. This 3. 1 plus 5 it's 6. 6 plus 2 it's 8. Then the answer 8. By multiplying this we got the number as 8. We need to write it here. Then we want to multiply to 1. Then we got the final answer as 180. Understand? We want to write this then in left side. Want to do cross multiplication. 5 into 1 it's 5. 3 into 2 it's 6.
You may not be interested in math, right? OET people.
It's nice, fathers. Interesting.
But then this is how they practically learn, no? When they start working their brain. No? Let me check one more girl. How they teach. That's medicine, yeah.
And I'm studying in class 8 and I'm from Sacred Heart Convent Senior Secondary School, Chengalam in Kottayam. Do you find maths a difficult subject? But really, maths is an interesting subject and it's very fun to learn maths. So I'm here to introduce a few tricks which will help you to make maths more easier. So the first trick is that how to find the square of any 2-digit number which ends with 5. So we are going to some examples. So first we want to take any two-digit number that ends with 5. Here I am taking 25. The square of 25 means 25 into 25. First, we want to multiply the ones place digit. Here the ones place digit is 5. So multiply 5 into 5. That is 25. So always write 25 at the end. Then we are taking the tens place digit, that is 2. So the next number of 2 is 3. So multiply 3 into 2, that is 6. So write 6 here. So the total answer is 625. Then we are going to the next
See,
example.
this is within fraction of seconds they can do. There is no other thing. Any number ending with 5, any number, square will be 25 will be the last two digits. Then multiply the first digit with the next number. 2 is here, 2 into 3 is 6. So immediately, within no time. 5 means immediately 25 is the last two digits. It will not change. Then 25 into 25 or 75 into 75, any number. Within fraction of seconds, they can do it.
Example, we can take here 35. So the square of 35 to 65. So multiply the ones place digit. Here the ones place digit is 5. So multiply 5 into 5. That is 25. The next number of 6 is 7. So multiply 6 into 7. So that is 42. So the right answer is 4225. Total here there is 2 zeros. So there is 2 zeros. Put that 2 zeros here. Then multiply 5 into 5. That is 25. So the total answer is 2000.
Yes.
Father.
Yes.
Hello. Father, she has written six nas. Then 6 means we have to multiply with 7, right?
Yeah.
Then suppose if it is 3 means with 4, we have to multiply.
Yeah, with 4. Yeah, with the very next number.
Okay.
So, like you need to know only the table till 5th, 1 to 5. Even there is a method where you can simply calculate 7, 8. If you don't know, there is a simple method they are teaching in other videos where you can multiply without knowing the table within fraction of seconds. So speed is important here. These are the kids who are just capturing these things at their home. See, the phone is used for better purpose.
Yeah, I will teach my children.
Yeah, you can learn this. So many things are there. This is the girl I said, 7th standard girl who taught reading part C.
Okay.
This is a video. She speaks about high school girl. And these people, like during Corona, we did all these kids programs, We have taken 8 schools. We did not capture or edit so many things. But then one thing, maybe here there is one video I'll show you. How they analyze that one, no? Probably I'll show you one sec. The then Chief Minister, who was the then Chief Minister? What's the Chief Minister? If there are Malayalis, you must see this video, okay? By, who is that? Manju Bhaskaran. You can just type at EduSkills OET, the YouTube channel Manju Bhaskaran, if you are Malayali. She is the one who did miracles within weeks and got grade A. But she never speaks English. Not even a single sentence. She is frightened of. How do you analyze it? We can also find all what you call MSc degree students doing paragraph analysis, enjoying their studies. Let me check if I can see one video.
Oh.
Sorry?
No, Father, power cut here, no current.
Well, no, my YouTube is going very slow. Issue. So many videos are deleted. With claiming copyright issue, but we have not violated any copyright issues. No time to fight legal. So it's same. Yes. I'm not able to know it very slow this. I'll find next day and give you. Yeah.
Okay.
Let's go. We'll show you that. So that's it. Anybody wants to take in charge of kids program?
Father, can you repeat that the last one?
Which one?
That 5 or 25 she has written, no? Can I see that?
Any square. Square means 25 square means 25 into 25 or 65 square means 65 into 65.
Yeah,
So the
that
last two digits will be 25.
Yes.
25 square means last two digits 25. Then 2 is the first number, right? Which is the next number?
3.
3. Multiply 2 with 3.
6.
6. So that is the 625 is the answer. You need not do anything.
Okay, actually I'm multiplying with this one.
Otherwise,
25.
you have so many steps. But 35 now do it for with 35 into 35 into 35 means 35 square. Answer immediately.
I got it, Father. Thank you so much.
What is 35 into 35? What is the answer? Immediately do it. 25. Then 3 into 4. 3 into 4 means
25. Yeah.
Yeah.
3 into 4, na?
1225.
1225, yes.
Yeah, within fraction of seconds.
Mm-hmm.
Otherwise, they have to do so many steps. That will have to do for the maths purpose. But for competitive exams and all that, you can within no time you can find the answer.
Yes, yes.
It's in with lightning speed. These are kids, just they are beginning practicing. That's why they are capturing and all that. No.
Yes, yes. I will teach
Otherwise,
my children.
no steps are required.
Yeah.
Yeah.
Thank
And
you,
11
thank
into 11 into 11, you have to just add the 1 into 1, right?
1 into 2.
Yeah. The other thing is anything multiplied with 11. You have to just add the numbers and write the first and last number.
Mm-hmm.
Yeah. Everything, for everything, there is a trick. That within no time you can do it. Now they are explaining it, teaching, they don't have that ability, no? So they can do. Otherwise, they will do within. What happens, when they get these tricks, they get interested in maths. That's the main thing. Once you fall in love with something, then you will love. Otherwise, you hate it.
Yes.
Yeah. Anything, if you make them interesting, that will be cool. Then the kids will manage. Now we'll be taking it from the beginning for those kids. Those who are registering once in a week. First, we will be giving them brain enhancement therapeutic games. One game for 1 week. The parents will have to do with them. That way, we will train them with some 21 games. Then definitely their brain will be enhanced at least 40%. Their brain will be improved. Then
Parents and father.
Yeah.
Parents and children.
Yeah, parents have to give practice because they are not in real classroom, no? They may not get it.
Okay, okay.
For example, now I taught you, you will teach them.
Yes, surely.
But then after some time, once they get into the track, they will do by themselves without any difficulty. If they are small kids, if they are above 4th standard, 3rd standard, they can do by themselves. But those games, they need some companion. If you have only one kid, you have to play with them.
Okay, okay.
Those are therapeutic games. The child cannot play alone, no?
Yes, yes.
Then sometimes you have to fail. They have to succeed. You have to plan all those things. If always you succeed and child fails, then child will not be interested.
Yes, yes.
You should become a child and learn to fail. It's the only thing people don't want to do what need to be done. Our education system never teaches them how to learn. That will teach them by heart everything.
Yes, yes, correct, father.
For example, people start writing their essays even from before high school days. Even if they reach PG or PhD, they don't know what is a paragraph. Then how do they write the essays? So nowhere they teach, there is a topic sentence, there is supporting sentence, developing sentence, conclusion. There is a introduction has certain parts, body paragraphs, conclusion that has got some different parts. Nothing of that sort.
Even myself too, I don't know. After coming here only, I know about the paragraph structure.
Yes. Yeah, Prabha is supporting Vantika, it seems. Vantika is very happy. No, Prabha, no, Madhuri, yeah. Yes. Now, Edu numbers are almost concluded. Hope you have got it, all the active members.
Yes, sir.
Those of you know, like Ganesh has put Edu 1, no? Ganesh Edu 1, if you can put that number, like Bharati has put Edu 25. You know how to edit the profile, you can add that number with your name.
Yes.
Yeah, sometimes for my reference also it becomes easier. Those are got numbers. So even while admitting, it's easy to admit immediately. Because there are some names, there will be many names in the waiting room. We may not know. In the waiting room, we can't see photo, right? Only the name. So which Prabha? We don't know. So if we have a number, immediately we know. It's our candidates. Even if they are coming in between sessions also, sometimes we may consider them. Then since they are active learners. And yes, Ganesh and all, you'll have to plan a little more, okay? Discussions. Because, today almost 42 people were attending live. Since that delay was there, it came down to 24. So some or other little more. It's okay. In the beginning, there will be some hiccups. But only those people like Mini and Nitya, because they took up the challenge. One was sharing, Mini was sharing, Aina. She was sharing continuously. That's why that batch succeeded. If everybody go to try and learn during the discussion, that will spoil the curry. Otherwise, you can enter Zoom and practice before sometimes until you learn. It's free. Zoom is free for 40 minutes. There is nothing like discussion. People can just enter and check whether these things are all right. And at least two should be ready to share, because one can be disconnected automatically, right? Suddenly one can go disconnected, especially when it is monsoon, rainy season. There could be some disturbance. So someone else should be ready. Yeah, that's cool. So keep rocking.
Thank you, Father.
Thank you, Father.
God bless you. Bye-bye.
Thank you,
Yeah.
Bye-bye.
Thank you, Father.
Thank you, Father.
Yes,
Thank you so much, Father.
Father,
Yeah.
general
Yes.
knowledge. Thank you so
General?
much for general knowledge.
What is that?
General knowledge.
Yeah,
About
general knowledge. About
yeah.